Good evening, students. Today I'll see about innervation of urinary bladder. First we'll see about development of urinary bladder. The development process has three sources of the development of the urinary bladder. One is the vesicoquadrantral canal, that is the endoterm. It's a major part of the urinary bladder and the prosthetic urethra. And proximal part of allantois is the endoterm, the apex of the urinary bladder. Then proximal portion of mesenteric, there is a mesoderm, trigone of the urinary bladder. These are three sources of the mainly forms the urinary bladder. First, next we'll see about anatomy of the bladder. Anatomy of the bladder. The anterior most element of the anterior in bladder anterior structure is mainly for pelvic viscera, the pelvic visceral cavity. Then we'll go for situated in the pelvic cavity when empty but expands superiorly into the abdominal wall. The pelvic cavity is empty, expands superiorly to the abdominal wall. At birth, extraperitoneal area of the lower abdominal wall. As 5 to 6 years, descends into the true pelvis. Okay. Then we'll go for anatomy of the bladder. In this diagram, we'll go for the trigone is there. In this, the above the structure, triangle structure. There is a trigone. This trigone, the smooth triangular area between the opening of ureter and the urethra of the inside the bladder. Okay, this is the opening of the urethra and urethra of the urinary bladder. Then we'll go for the ureter pierces the bladder wall obliquely, travels to 1.5 to 2 cm and terminates with the urethral orifice as it passes through the hiatus in the detrusor muscle. That is, it compares to narrow considerably. Then we'll go for parts of the urinary bladder is mainly for four parts: apex, base, superior surface, and info lateral surface. Then we'll go for anatomy of the bladder, mainly for detrusor muscle. In this is a layer of the urinary bladder wall made up of smooth muscle fiber arranged in the spiral, longitudinal, and circular bundles. Then a sphincter. Two types of sphincter present: internal and external sphincter. The internal sphincter is a smooth muscle that is covering the bladder neck and the proximal urethra. External sphincter is a striated muscle that is a membra. Then we'll go for higher center control. Okay, cortical control area. A cortical control area, the frontal and cingulate gyri is the subcortical nuclei structures present in this area. Inhibition is mainly for maturation at the level of pons. Inhibition at the level of maturation at the pons. Then excitatory function is the external urinary sphincter. Voluntary control of the maturation. Then a Pontin maturation center is mainly for Barrington nucleus present in this region. Coordination of the maturation. Then we look for spinal maturation center, mainly for T11 to L2 vertebra, both sympathetic and parasympathetic innervation. Then maturation bladder innervation. The parasympathetic supply is the S2, S3, S4, mainly for contraction of the detrusor muscle and relaxation of the internal sphincter. Contraction of the detrusor muscle, relaxation of the internal sphincter. That is a facilitate the maturation. Then a sympathetic supply is L1, L2, L3, mainly for contraction of the external sphincter. Contraction of external sphincter, that is a voluntary control, that is withdrawal maturation. Then you go for no supply of the urinary bladder. The parasympathetic efferent fibers mainly for S2, S3, S4 are the motor to detrusor muscle and inhibitory to the sphincter vesica. Then sympathetic efferent fiber is a T11 to L2, inhibitory to detrusor and motor to sphincter vesica. Then the pudendal nerve is S2, S3, S4 supplies the sphincter urethra, which is a voluntary muscle. Sensory nerves is the pain sensation by both sympathetic and parasympathetic nerves. Then in this pathway, the blue color diagram is there. First the bladder, the urinary bladder. The edge of the urinary bladder attached to the first is the neck. Neck is below is the proximal urethra. Neck and proximal urethra it's developed by the internal sphincter. Then below external covering of the external sphincter. Okay. Then we'll go for sympathetic nerve is this hypoglossal nerve. Then L1, L2, L3. These nerves arise from the urinary bladder. Then we'll go for efferent fibers. Means parasympathetic S2, S3, S4. We'll go for urinary bladder. Okay, urinary bladder. Then receptors. Okay, receptors. Then we'll go for the urinary detrusor muscle is the contraction. Internal sphincter is the relaxation. It will mainly go for the other stretching external sphincters contract and move out the widening of the urine. There is a maturation reflex pathway is there. First center is a cortical center. Cortical means a nucleus. Prefrontal area mainly for subcortical nucleus present. Then we'll go for brainstem pons. Pons mainly Barrington nucleus is present. This removes the Barrington nuclei. Then you will go for the spinal cord structure. Spinal cord structure T10 to L2 area, that is the L1, L2, the sympathetic nerves races from this area. Then we'll go for receptor. Efferent receptors go for bladder. Okay. Then we'll go for sacral maturation, S2, S3, S4. There is a parasympathetic nerves. This efferent nerve will go for bladder. Okay. This will entirely go for bladder to internal external sphincter. Will go for widening of the urine. This is the pathway of the urinary bladder sensation. Okay. Thank you.